next, because what I want to talk to you about is the intradase laser for making corneal flaps. So these are the things that I'd like to achieve in the next 15 minutes when I talk to you. Obviously, I'll give you a little overview of the technology behind and inside the intradase laser, but I'll be concentrating on very much what it's contributed to the public mind in terms of reassuring potential patients about the safety of the procedure. Critically, it's blade-free, and I can't really stress that enough, that the fear factor still remains the biggest obstacle to suitable patients coming forward for this very safe and elegant treatment. So the blade-free, no-cutting, all-laser approach can't be overstated enough. And then finally, I just want to say a couple of words about your role in promoting this procedure, and in particular the intradase participation in this procedure. So we've already heard in great detail about the different types of laser refractive surgery, so I won't dwell on that apart from to say that the original method, PRK, has been around for more than 20 years, I think. It works very well. You've already heard this evening that over time the final result is very, very similar. That was updated slightly by using a slightly more elegant means of removing the epithelium, so that's LASEK. Even so, both of these first two procedures will involve some discomfort for the patient and some inconvenience, because they probably won't be able to work and function normally for 2, 3, maybe 4 days in the case of the hyperopic treatment. So the wow factor, as they say, in laser refractive surgery has been provided by LASIK. So a corneal flap is lifted and the laser treatments are applied to the stroma below that corneal flap. To set the scene first, here's a short animation, if you could play it for me, of the bladed version of LASIK. Now, fortunately, most patients don't get to see this animation, so they don't have to consider the risks and downsides of an oscillating blade traveling across the eye. We all know from basic engineering, anything with moving parts is going to have some problems at some stage. Okay, so some essential limitations of the microkeratome. The thickness of the flap that it produces is determined by the gap between the blade here and the foot plate. So clearly there are only some fixed flap thicknesses that you can choose. So it can't be tailored to the individual patient or the individual prescription. So there are some variations in the flap thickness, both in its central portion and across the whole spread of the flap, depending on intraocular pressure, the performance of the microkeratome. There is evidence to suggest that the stromal bed is of inferior quality, and of course everything depends on the blade. These are mass-produced, mass-manufactured, and have an amount of variability inherent in them. As mentioned, there is a limited amount of customization and flexibility that is restricted by the fixed flap thicknesses that are available with microkeratomes. And there are also, again, studies to show this, that there are margins of error in terms of the flap thickness, which can be up to 20 or 30 microns, which is probably something like 20 or 30% of the intended, so quite a large margin for error there. Now, I won't bore you by reading out all of these potential complications of using a conventional microkeratome. Just Suffice to say that if we all do our job correctly, we should be informing patients preoperatively of potential complications. So it's quite a long list. It's going to take me quite a while to adequately inform the patient. So let's consider it from the patient's point of view. I've already mentioned the fear factor, which I think we'll all agree is what prevents patients coming forward for this otherwise very elegant and safe procedure. So patients need to be reassured, and they are more reassured by knowing that they're going to be treated with a laser than they are when you talk about cutting or blades. Quite rightly so. Even so, there is a kind of emotional element to that, apart from the science and the statistics. So patients want a treatment that is going to be safe. They want to avoid any severe complications, and they've also probably read about night vision problems. Well, we stopped counting after the first 2 million procedures, and we're well over 6 million procedures with the intralays now. And there were no serious sight-threatening complications. So we know that flap creation is the major risk factor in the LASIK procedure. So the introduction of intralays has significantly reduced that, almost eliminated serious sight-threatening complications. So how does it work? What does it look like, and how does it work? So it's a laser. It uses infrared laser beams, so patients don't see it. Crucially, it's also silent, so patients are not in any way intimidated by it. We have over 1,500 machines of that kind installed worldwide, and as I said previously, over 6 million successful procedures and counting. These are some of the most important clinical benefits. So you've already heard this evening about wavefront guided corrections, which target higher order aberrations, as well as correcting ones that exist preoperatively. We wish with this LASIK procedure to avoid the induction of higher order aberrations, and the intralays makes a significant contribution towards that. Quality of vision is increased, enhancement rates are reduced, and although the final outcome may be the same or similar, the part of the wow factor of LASIK and intralays LASIK is the faster recovery, allowing patients to return to normal function much more quickly. We've already discussed there are fewer sight-threatening complications, and critically, it is consistent and reliable, meaning that the surgeon can target a thinner flap for a variety of good reasons and be sure that that thinner flap will be achieved. So, to summarize the advantages before I get on to how it actually works technologically, the unique features compared with alternative manual methods are that we can program the computer that drives the laser to provide the optimal parameters for any one surgery or any one patient. We can use thin flaps to preserve the stroma, so not going as deep, which expands the range of corrections that we can do, as well as being safer and leaving more of the cornea untouched. Its predictability is the key factor in allowing us to tailor the treatment in this way. So the laser beam is focused to a very precise depth, typically around 100, 110 microns, which, just to put that in context, that's about the thickness of a human hair. So that's the depth that the laser will be penetrating into the cornea. It creates the ideal surface for excimer laser correction once the flap has been elevated, and produces a very clean edge to the flap, unlike the more rough edge produced by the oscillating blade that you saw earlier. And that leads to benefits in terms of resisting displacement. Again, you heard that originally LASIK was not allowed or not preferred for anybody that might have a risk of trauma to the eye. And that position is moving now in that airline pilots now are, generally speaking, allowed to have LASIK depending on the airline. And critically, there is less risk of epithelial ingrowth than with a microkeratome blade. It preserves the stroma, so we want to apply the appropriate correction but minimize the depth that we go into the cornea to leave as much cornea intact and with as much mechanical stability as possible. So Intralase provides that, which in turn widens the base of treatable potential LASIK candidates. It provides confidence for the surgeon, so he knows that he's going to achieve this thin flap that he's aiming for, allowing him to treat higher prescriptions. And we know from very good scientific work done at the Institute of Ophthalmology by John Marshall that this approach, the subbonus keratomileusis, actually preserves the structural integrity, so the strength of the cornea, far more than a mechanical microkeratome can ever do. How does it work? The laser beam is focused to a small laser spot of about 1 micron, at which point the energy is so concentrated that it creates a little plasma burst. That plasma burst creates a gas bubble which expands by a factor of about 5, so going from 1 micron to 5 microns, still incredibly small and discrete within the eye. But crucially, that is enough to separate the layers of the cornea. Notice I said separate, didn't say cut. It's one of the things that you have to kind of adopt when you are talking about femtosecond LASIK flaps. And if we repeat that process, putting the bubbles side by side, in effect, you create a resection, not a cut, a resection, which forms the base of the LASIK flap. So everything I've just told you, this is now encapsulated in this animation. So the cornea is applanated to give us a nice flat surface to work with. Those laser spots are put in a raster pattern at much greater speed than you're seeing here, of course. And only finally do we do the side cut that comes up and round. So should anything, and it's very rare, should anything go wrong during the procedure, you can stop and you haven't actually opened the eye to the elements. So only when the treatment has been completed successfully do you open the eye to the elements. Just to reaffirm, really, that the patient gets the wow factor, the quick recovery, but we should not forget some of the more crucial benefits, that the risks of keratitis or ectasia are greatly reduced, almost eliminated with femtosecond flap creation. Early post-operative results are superior, so the patient functions better almost immediately, as you've heard from Mr. Pillai. The predictability gives the surgeon greater control and greater planning ability in terms of the ideal or optimal treatment, and the faster recovery of corneal sensitivity may lead to earlier reduction in post-op dry eye, which you're probably aware is a feature of LASIK treatments. So, in conclusion, it's more precise, it's customizable for each patient, greater accuracy, so it's an important tool for the surgeon, and it is safe and reliable. This is the hurdle, this is the barrier that we need to overcome. your role in that is that you're providing benefits to your patients, to your practice, and your profession by increasing the confidence that the general public has in laser refractive surgery. The intralaser, and we can prove this statistically, or the arrival of femtosecond laser flap creation created a resurgence in interest in the market in laser refractive surgery, critically by reducing the fear factor. It's high tech, you'll see that soon. It's high tech and it's expensive, so not everybody can afford it, and I would venture to suggest that only serious providers of refractive surgery will invest in such technology. And it gives you the opportunity of being associated with that technology and being part of the latest generation of LASIK and refractive surgery provision. So I commend it to you and hope that it will become part of your counselling process and your armamentarium when considering the options for LASIK candidates.